Hello everyone, this is Muhammad Awais bin Abdul Malik. I am a first year internal medicine resident currently training at Advent Health Orlando, and today I'll be presenting a rare case of cocaine induced acute pancreatitis. So, to begin with, pancreatitis, we do know that it is an inflammation of pancreas associated with specific imaging finding epigastric tenderness radiating to back and elevated liver lipases, and it is one of the most frequent cause of GI hospitalization, usually linked with gallstones, alcohol use, and hypertriglyceridemia. Drug-induced pancreatitis, though, is less common, but it is well recognized. So today I'll be presenting this case about a guy who was 53-year-old male, which we recently encountered, and he was positive for cocaine, and he was actually diagnosed with acute pancreatitis. To add on, it has been just reported in fewer than 10 case reports in the literature to date that cocaine is associated with acute pancreatitis. So to begin with, our patient, he was a 53-year-old male who had this lower quadrant, upper and lower quadrant, left-sided abdominal pain that was acute and dull in nature, associated with nausea but no fever or diarrhea. Patient denies any alcohol consumption or any history of GERD. On examination, there was generalized abdominal tenderness but no guarding, rigidity, or no rebound tenderness. Initial evaluation revealed a lipase of 1130 units, mildly elevated IgG4. Urine tox was positive for cocaine, but blood levels were negative for ethanol. And pancreatitis was diagnosed on gallbladder ultrasound and initial CT scan. Patient was managed conservatively with pain control, IV fluids, and he improved the next day and was discharged. 1 month later, he came back to ED with similar abdominal pain. Lipase was high, it was 1931. Repeat imaging revealed acute interstitial pancreatitis without gallstones or biliary obstruction, which was later confirmed on MRCP, which revealed no cholelithiasis or cholelithiasis. Patient initially declined cocaine use, however, a subsequent urine screen confirmed recurrent cocaine exposure. Patient was treated with IV hydration, multimodal pain control, and symptoms gradually improved. During the hospitalization, patient was evaluated by substance use disorder team and received counseling and resources for cessation of recreational drug use. So drug-induced pancreatitis, we do know that it is estimated to account for roughly 2% of all the acute pancreatitis cases. Usually the most common causes are gallstones, alcohol, and whenever we encounter a patient, those should be evaluated first, but at the same time we should not miss the rare causes such as pharmacological triggers, metabolic causes, autoimmune causes, especially when somebody is coming to the hospital again and again with the similar issues, or if somebody is having idiopathic causes. To talk about the pathophysiology associated with cocaine, so cocaine is associated with vasoconstriction and ischemia of the pancreatic microcirculation, and the direct cytotoxic effects and immune-mediated reactions or metabolic disturbances add to the vasoconstrictive and ischemic effects of cocaine that results in acute pancreatitis. And it has been reported in some of the case reports. A systematic review published in 2021 revealed that about 7 to 8 cases worldwide has been reported of cocaine linked with pancreatitis. So this article literally has very significant literature importance, and it actually adds to the limited literature associated with cocaine. So conclusion is cocaine induced pancreatitis is extremely rare, and whenever we encounter an unexplained or recurrent acute pancreatitis, we should do CT and MRCP to rule out any underlying cause, and a careful history and toxicology screening are crucial in identifying less common etiologies. This case highlights the need to keep an open differential and to consider illicit drug use when standard causes are absent. This was a brief presentation about cocaine-induced pancreatitis. I hope you guys like this presentation. If you have any questions, I will be willing to answer all of them.